First it was Merthyr Tydfil, now the Lower Cynon Valley. A second mass testing programme launched in Wales today. One of the locations, this converted indoor bowls centre in Mountain Ash, in a local authority area witnessing rising infection rates.
How worried are you by the number of cases at the moment?
Very worried. I know spring chicken, I wouldn't like to catch it, so I'm very worried, and it needs to get sorted as soon as we can. I hope everybody turns up and does it.
Open for rapid testing today, it's already been earmarked as a future vaccination hub. It was a subject the council leader hinted could yield further news in the days ahead. He'd had a text message, he told us, from the Welsh Government.
My understanding is that there's a second vaccine could be signed off in a matter of days. We've been asked by the government to put plans in place potentially for that to happen. If it does, obviously we need to be ready to start vaccination with that. But the message is it does look positive from the regulators.
The Welsh Government today said it has plans in place to roll out vaccines as and when they become available. The regulator, the MHRA, didn't comment. Only the Pfizer-BioNTech vaccine has been approved in the UK to date. 800,000 doses are due in by the end of next week, with all 4 UK nations set to begin the rollout on Tuesday. And yet amidst the optimism surrounding vaccines, it was a dose of reality the 4 chief medical officers sought to inject into the debate today. In a letter to colleagues highlighting the logistical challenges involved, they warn that vaccine deployment will have only a marginal impact in reducing numbers coming into the health service with COVID over the next 3 months. In Wales, where the infection rate outstrips other UK nations, latest efforts to reduce hospital admissions have seen hospitality venues banned as of last night from selling alcohol. Numerous pubs and restaurants have closed until the next review date, amidst a backlash from many in the sector. Meanwhile, the Welsh Government pushes ahead with mass testing. There's been criticism today again that the rapid lateral flow tests miss positive cases, 50% in one study. But the Director of Public Health covering this part of South Wales still considers it a useful tool in helping thwart community spread.
If I tested 10 people who were positive, picked up 7 of them and missed 3 of them, whilst I can accept that that test is not perfect, do you know what? I can live with that. And do you know why I can live with it? Because those 7 people who were infected, who I identified successfully using lateral flow, I would have missed them under normal circumstances. So it is not perfect, but it is better than what we had.
One day they may be using this centre for vaccinations. As the UK prepares, Russia starts. Its own Sputnik V vaccine programme is underway. 95% effective and with no major side effects, say its developers. But it's still undergoing mass testing.
Well, as the fight against coronavirus dominates the world's attention, other diseases continue to kill on a massive scale. Malaria claims more than 400,000 lives every year. But now a cheap and effective vaccine could be imminent. The team behind the Oxford Covid-19 jab are about to begin final stage human trials on a new inoculation. It'll be tested on children in Africa next year. And if the trials are successful, it could be in use by 2024. Here's Aisha Tull.
229 million cases worldwide, not of Covid-19, but malaria. While the disease is less deadly at the moment than the coronavirus that we've come to know so well, the victims tend to be children, mainly in poorer countries. Malaria vaccine development has been going on for decades, but there's been a breakthrough.
We're now at the stage where we're moving into what are called phase 3 trials, which are the final stage of testing of any vaccine before it can be licensed.
Lots of people will be familiar with the COVID vaccine because we've heard lots of news about that. But what's the difference with a malaria vaccine?
So a malaria vaccine is harder, to be frank. People have been trying to make malaria vaccines for many decades. Malaria is caused by a parasite, a much bigger beast than a virus. But now we're beginning to see signs that this really could be pretty effective and is very, very much needed.
While the development of a more effective malaria vaccine is good news, there are concerns that the money to get the jab where it's needed may not be available.
it looks as if the overseas aid budget is going down. In fact, it is from 0.7% of GDP to 0.5%. So that's a substantial cut. And that worries lots of us working in the malaria field, that there will be less money around. If this vaccine really works, we're going to need quite a bit of money to make sure it's manufactured at scale and widely available.
There's only ever been one other malaria vaccine made, but that's not fully licensed, so a new jab on the scene could make a difference. The latest figures of malaria deaths show over 400,000 people died in the last year. Children under 5 are the most vulnerable group, and in 2019 they made up over 2/3 of all malaria deaths worldwide. Developments in fighting the disease have stalled in recent years. Mosquito nets and treating stagnant water can only go so far. And for researchers who have visited the worst affected countries, they say this, along with COVID, needs to be a priority.
It's critically important. It isn't a case of one disease over another or one issue over another. The health of all of us is threatened by these infectious diseases. We will continue to see new emerging threats. And if we can reduce the burden of those diseases that remain, things like malaria, then we will all be in a safer place.
Trials start early next year in Burkina Faso, Tanzania, Mali and Kenya, with the big hope that promising results would mean a vaccine rollout by 2024.